you mentioned titration. I think that's something when I was talking with Wendy, that was something we got into because from her experience running a store, she noticed that a lot of people are not exposed to that process of trying to find kind of the minimum effective dose and to know, what you're working with. So can you describe a little bit about, for instance, right now with CBD being so popular, if people are running out trying to, find a product and trying to find a dose, what does that titration look like, and how low do you start, and kind of how much time do you wait to pass before you up the dose, that sort of thing? Just describe a little bit what that process looks like.
So very different between children and
Yeah.
adults. Actually, with the pediatric community, the parents were very familiar with titration.
Yeah.
As you know, even with your baby Tylenol,
Yeah.
everything comes in a liquid.
Yeah.
And even with anti-seizure medications, things like that, everything comes in a liquid, and they knew how to titrate. They know how to titrate. They know how to, and as a parent, if you look at your child and they have this glaze over their eyes, you already know they're sick, right?
Mm-hmm. Yeah.
That doesn't take much.
Yeah.
Parents are very intuitive. For adults, it's a little bit trickier.
Mm-hmm. Yeah.
I think we have higher pain tolerance. We sort of kind of just power through things. Or we want instant gratification.
Yeah.
And we want that CBD to work now. Yesterday. How come it's not working?
Right. Yeah. Yeah. No, exactly.
So it's easier to work with pediatrics, actually.
It's easy for adults too to, like, I don't know, really confound variables and things too when they're sharing what they're doing. And what were the given that children and adults are so different just in like surface area and metabolism and that sort of thing, I know that in the early days you probably didn't have access to really sophisticated dosaging data because there weren't even, I mean, I'm trying to think of when testing labs really started to come along. I mean, Steep Hill was one of the early ones in California, but that still was not that long ago. But based on your experience now, what are some of those dosage differences between children and adults?
So with children, I'm just thinking of kids that are my autism patients, for example, or kids that are have self-injurious behaviors.
Yeah.
That accumulation of cannabinoids can really take a toll on them. So parents might notice that things are working really well for the first 2 to 3 weeks. There's this, what I call the honeymoon stage.
Yeah.
And the child is really, even keeled, grounded, really feels comfortable in their own skin. And then all of a sudden it starts to turn at the 30-day mark, maybe, and they notice that the child is just more hyper. The motor tics sort of amp up, or they just feel like they're a little bit more like hand biting, or the repetitive echolalia, where they're saying things over and over again, that might uptick as well. And I find that to be the case as the cannabinoids build up in their system. So less is more. And I actually find it a little bit harder now than it was when I was practicing in California, because information is so readily available. And there's just, there's 8,000 products available. So parents are trying all these different products, adding this, adding that. How come that didn't work? I read on Facebook that this brand works. So I tried this brand and I added, 0.5 milliliters, another 5 drops, another 10 drops.
Yeah.
And so it does get muddy. But really staying the course, and I mean, sometimes I have to handhold a lot of these parents and just say, no, you want to stay with 0.2 milliliters of this brand for 30 days. Just hang in there. I know you're not getting the results that you're getting, but we're doing it slowly. Then talk about sleep hygiene. Talking to the physical therapist or the speech therapist. Sort of tweaking things that way. With adults, it's the same thing, being patient, knowing that to decrease inflammation in the body takes time.
Yeah.
And I actually really encourage the adults, let's say we're talking about, chronic pain, for instance, or even insomnia, to add in exercise, meditation, sleep hygiene, getting off the computer and electronics, 2 to 3 hours before bed. So it really takes, I would say, a lot of other approaches,
Right.
not just the cannabis.
Yeah, exactly. And when patients are going through that process and trying to kind of find the, I guess, sort of like the plateau of therapeutic response, how long do you prefer them to wait before, you would make a judgment about what that cannabinoid therapy is actually doing?
A month.
A month, yeah. Hmm.
I know everyone frowns.
I mean, but
They
that's
don't want to wait a month.
yeah. I mean, but that's really common with a lot of other drugs. When you're working with a physician and trying to find dosaging, a lot of times you might only see a doctor once a month or so, and that's usually kind of how it goes. So it's not that surprising, but I can understand that that's not necessarily the message a lot of people want to hear, because they do want to see those results. And another thing you just touched on is sort of this like biphasic response that cannabinoids have. That at certain dosages they do one thing, but then as they build or as you increase dose or whatever, you all of a sudden get to this other side of this curve, this dose response curve, and you may be having less effect or a negative effect.
Yeah. Yeah.
And I think that's critical. I'm glad you highlighted that, because that's something that I think needs to be talked about more in the context of using cannabis as medicine. And I think that's largely a reflection of sort of this. It's not just the United States, but this kind of mentality that we have of like, more is better, and if a little bit was helping, then take more and take more, and we have a sense of tolerance, but that biphasic response is something I think that we don't necessarily have a large appreciation for. And some people, when they might be on that other side of the curve, they might think they've just built tolerance. And so then they add more and more to try to
Yes.
overcome that
Yes.
tolerance.
Exactly.
Yeah.
Exactly.
Yeah.
Exactly. And I mean, and we, when we look at medicine, we do that at the doctor's office when you're being prescribed blood pressure medication
Yeah.
or diabetes medication. You come back and you retest.
Yeah.
Maybe your sugars aren't quite controlled, so we'll adjust it, or your blood pressure. Even antidepressants, anti-anxiety medications.
Yep.
Doctors will tell you it takes 6 to 8 weeks to see if there's going to be a therapeutic response. And if it doesn't work, they're going to have to switch to another medication.
Mm-hmm.
So same thing with pharmaceutical medications. And I know you have Kevin Spellman on
Yes.
before,
Yeah.
and I adore him. But we're looking at this plant that's affecting so many receptors that that's why everyone is so different,
Yep. E-
right?
Exactly. Yeah. And as much as we understand now, it's still only, this fraction of a piece of a puzzle that we're trying to piece together. One thing I really enjoy talking to Kevin about in that interview is, about the endocannabinoid system and just how complicated it is, and that, we kind of have maybe some general understanding of some of the things it's doing and the other receptor systems it's connected to and all this sort of thing, but we're still a long way. And this came out in my interview with Ethan Rousseau as well, that we don't have good ways of measuring this system. The definition of the system is like rapidly expanding as we learn more. And so it's really tricky. And sometimes I think there's a perception, especially within the cannabis industry in general, that we know so much, and so we should be able to use that information to really target treatments and make super informed decisions. And we can definitely make better informed decisions than we ever could. Um, but it's just not quite there yet. So a lot of it is still trial and error, moving slowly, trying to control as many variables as you can, and proceed with caution.